Go. So I'd just like to provide an update on coronavirus cases in Victoria for today. There have been 8 new cases of COVID-19 recorded overnight. 2 of those new cases are in hotel quarantine. 1 case is a close contact, so linked to the Ridges on Swanston outbreak, which brings the total number of Victorian cases there to 15. There has been 1 new case in a staff member who had previously worked at Bupa Aged Care Facility in Clayton. 1 new case in a toddler at a childcare centre in Parkville, and 2 further cases that are under investigation. That would be me. And finally, 1 case who's attended last Saturday's Black Lives Matter protest in Melbourne. So really, the lesson here is that it's not over for Victoria, it's not over for Australia in terms of ongoing cases being detected. We've always said that we need to keep watching community cases in particular. We're aware that there'll be cases that continue to occur in quarantine, but community cases are ones that we watch particularly closely. Obviously, that's a measure of ongoing transmission in the community. So the lesson for all of us is that it's not over. People need to remain aware that transmission continues to occur. It's a lesson that Victoria did the right thing in taking a very precautionary approach, in being very robust in the restrictions that were in place early and hard, and that our easing of restrictions have been measured and slow and appropriate. And that's absolutely because we've got ongoing transmission and because we need to see that continue to drive down to 0 before we can be really confident that a really significant easing of restrictions can occur. The cases are all under investigation. The appropriate actions have been taken for close contacts for the Bupa Aged Care Facility. The individual wasn't symptomatic while working there, but that facility is nonetheless restricting activities, is essentially in lockdown. Just in case it's been acquired there, it may have been acquired elsewhere, but the individual wasn't infectious while working there, so no risk of transmission from that individual to the Bupa Aged Care Facility. For the toddler who was in childcare in Parkville, again, unclear where it's been acquired, but everyone, staff and children, will be tested there. That child wasn't symptomatic while attending in childcare, but may have been infectious. So, within that 48 hours before developing symptoms. Potentially acquired there, potentially infectious while there. The case who attended the Black Lives Matter protest in Melbourne developed symptoms after attending, but really within 24 hours. So it would be very unlikely that it's been acquired from the protest. Normally people develop symptoms 4 to 6 days after being exposed to coronavirus. As you know, up to 14 days the incubation period can be, so the time from being exposed to developing symptoms. So for it to occur within 24 hours, it would be very unlikely that it's been acquired from attending the protest. Nonetheless, because of that attendance at the protest within 24 hours of developing symptoms, they were potentially infectious. So the lesson about warning people not to attend applies. The directions in place that limit mass gatherings, that limit gatherings of any size to 20 are there for a reason. I hope that anyone who's attended that, and indeed across Victoria, who develops symptoms that are compatible with coronavirus, really need to isolate themselves, get tested, get that result back, and become well before they get out and about again. Happy to take questions.
How much did that process set up? How much has that protest set back Victoria's recovery effort?
Look, we really won't know. Clearly, I made a very strong statement about not attending because of the risk of transmission. As I say, this case is unlikely to have acquired it at the protest, but we were all concerned about the possibility of transmission occurring at that protest or indeed in other places across Australia. And so we really need to keep an eye out. and people do need to have an absolute awareness that if they develop symptoms, including mild symptoms, so cough, sore throat, runny nose, shortness of breath, fever, but even change of taste or change of smell, sometimes it's diarrhoea and abdominal pain. So there are a number of symptoms that can be compatible with coronavirus. People need to bear that in mind and get tested.
What contact tracing are you doing for that? What contact tracing are you doing for that? Because obviously that person may be surrounded by thousands of other people.
So the individual did wear a mask. They weren't symptomatic at the time. But we will go through the normal process of identifying anyone who is defined as a close contact, so people who have had more than 15 minutes face-to-face contact with that individual. They will all be asked to quarantine, required to quarantine. So that's a normal process with any confirmed case in Victoria.
Did that person have the app on?
Sorry?
Did that person have the
I
app
don't know.
downloaded? And was that person likely to be contagious at the time, if you like?
So within 24 hours, there is the possibility of being infectious before you develop symptoms. How infectious someone is not clear, but it is known that people can transmit the virus, within 24 hours of developing symptoms. So that's a concern. It's obviously helpful that individual wore a mask, but masks are not 100% protection.
And that person, sorry, just to clarify, developed the symptoms on Sunday?
The following day, that's right.
So
So they may have been quite easily.
They may have been contagious.
So now what's the risk to the next lifting of restrictions? We're fast approaching June the 22nd. There's lots of businesses that are getting ready. Is there a risk that doesn't happen now?
Well, not by virtue of this one case. We are watching all of the community transmission cases each day. We've had 0 days. We've had days with, six cases that aren't in quarantine. So we need to continue to watch that right through to June 22. I've always said there are caveats around all of the easing of restrictions that involve that day-to-day watching of numbers. The general trend has been positive in Victoria. We've got fewer community cases in the last couple of weeks than from the previous, but we're not there yet.
The Prime Minister has said that these protests right across the country have set us back by a week. Do you agree? And there are talk about the protests this weekend, both here and in Sydney. What do you say about that?
Well, the same advice as I've always said. I recommend against it for the very reason that transmission is a risk. We don't want people gathering in groups larger than 20 in Victoria because of the additional risk of transmission to others. It is my strong recommendation not to go, and it is the law. The public health direction that I've laid out says that community gatherings shall not exceed 20.
People obviously completely ignored that, and we are starting to see the consequences. Should that, obviously, you made it clear that it was your strong preference that people don't attend. Could and should that message have been any stronger?
I don't know that I could have said it any more strongly than that. Public health folk across the country were pretty clear about the potential risk of transmission. There are different areas of Australia with different epidemiology that means that the risk is maybe not so great if you were to gather in bigger numbers in the Northern Territory that hasn't had community transmission. But for Victoria, I was entirely clear about the potential risk of transmission.
Does this worry you that it's only one case now, but what is the potential for there to be a spike?
Well, I think, again, I've been clear that the potential's there. I hope it doesn't happen. People were trying to distance in that gathering, but it's effectively impossible to the 1.5 metre requirement, and people were there in their thousands. There was lots of wearing of masks, but again, masks are not 100% either protection from you if somebody else is infectious, or indeed if you're infectious. It's a real mitigation, but it doesn't completely protect those around you.
Can you give any more details about him? Because I know we can't identify who they are, just an age and a gender?
Yeah, a gentleman in his 30s.
Would you urge people who attend to stay home as a result of this discovery?
No, look, the quarantine requirements are for known contacts of a confirmed case. But anyone who develops symptoms, no matter how mild, does need to isolate. That especially applies to those who've been to the protest because we know that they've had potential exposure. But it applies across the board in Victoria. Anyone who's developing symptoms, cough and cold symptoms, They might be mild, they might not make you feel unwell, but they are a reason to stay home and get tested.
Is this man who's tested positive, is he Indigenous, given that there are higher risks in the Indigenous community?
No, he's not.
The Prime Minister has urged states and territories to open their borders as soon as possible. What's your stance on that at the moment?
I don't have a stance on that. That's for those individual jurisdictions to make a call. That's entirely a matter for those states and territories.
What would you be recommending to Victoria about borders?
Well, we haven't had a border, so we've not closed our border to New South Wales. I think that's been an appropriate decision for us. But for any other jurisdiction, it's entirely their call. They are weighing up the public health risk of cases being imported into their jurisdiction against what the economic and other tourist or costs might be for them.
Does it concern you, does it concern you just in relation to protests that there are reports that the organisers of Black Lives Matter protests have not received fines yet, which could act as a deterrent to further organisations organising rallies?
Yeah, I'm not aware of whether fines have been issued or not. It is a matter for Victoria Police to make that call.
Are we not in a state of emergency and you're equipped with extra powers so that you can be more forceful on this stuff? And if there are protests in the future, you can be a bit more forceful rather than recommending against it?
Well, it wasn't just a recommendation against it. The law is there. The public health direction has penalties associated with it and is law under the state of emergency.
But that law hasn't been enacted if the protest organisers haven't received fines.
Well, as I say, it's a matter for Victoria Police to enforce and to make a decision around how they will issue fines accordingly.
Are you able to say whether that protester who's tested positive has come from one of the areas like the Kinmore area where we've seen a cluster in the past? Is that potentially where they've caught this?
I wouldn't identify the residents of the individual.
What's the rate, the general rate of infection we're working on at the moment? So if this infected person is being, what's the rate we're working on? Is it you could possibly infected 2 people, 4, 5?
So the issue with coronavirus is that without additional protections, without mitigations, if you like, one person on average infects about 2.5, 3 other people. But every individual will be different. The majority of people don't infect anyone else. 70, 80% of people don't transmit to anyone else. But there are a smaller proportion, 20, 30% of people who will spread it to a number of other individuals in close contact.
Obviously, if they're in a crowd of thousands of people, those risks would be elevated, presumably?
Yeah, the risk is elevated if you're in closer contact with people and the greater number of people who you mix with. Outdoors is a lower risk, and masks are a mitigation. And obviously, if you've got very minimal symptoms, you might be less likely to be infectious, but people with no symptoms and people with very minimal symptoms can still transmit the virus.
There's been another case at the Riches Hotel. Why has this hotel had an outbreak when other hotels hosting return travellers hasn't? And what's changed at the Riches since?
So the Riches Hotel was clearly a site where transmission occurred to staff who were there. We don't know exactly what's occurred, but it seems that they've acquired it around the same time. So people working on the same shift or around the same period of time appear to have been exposed to the virus. We don't know exactly what's happened in that case. This additional case was a close contact of another confirmed case. So, it's also a lesson that people who are in quarantine who develop symptoms need to isolate themselves properly so that when they develop symptoms, they're not exposing anyone else. That is the principle of quarantine, and that's why people need to follow quarantine directions as well.
Just on the Parkwood Childcare Centre, has that been closed?
Yeah, that's been...
And are all parents and children and staff being told to isolate?
Yes, so the Parkville Centre, Childcare Centre, has been closed for 24 hours for cleaning, for the outbreak management team to go on site and investigate. Everyone will be tested, staff and children, and they'll reopen at a point where everyone's been identified appropriately as close contacts.
Which one is it? Sorry.
So the full name is the Professor Lynn Corcoran Early Learning Centre.
Thank you.
Just on, of course, the footy stats tonight, is what Victorians are very happy about that. Given what you're seeing over the past week or so, and then on top of that, these growing calls for fans to be allowed back in, South Australia allowing some in, what's your view?
We will take a very cautious and stepwise approach, as we always have. South Australia has been fortunate not to have had the same number of cases to begin with, and to have to look like they've effectively ended community transmission in the same way that WA and the Northern Territory have. So they have greater freedoms to lift restrictions than is the case in Victoria. But if we get in a similar situation, we can potentially make the same call, but we're not at that point yet.
Eddie Maguire reckons Victoria, when they do let fans in, they want to do it a bigger amount. So he suggested 10,000 people at a time. Is that true that the government is thinking that?
It's not a decision that's been made at this point. I think there will be considerations about what is a feasible crowd size and what's appropriate. So if it's a case of deferring the opening, but opening at a point where we can be very confident that 10,000 people can gather together, and that's not out of the question, in the next couple of months. But we have to see how numbers go.
Just on the protester, is it still under investigation where they might have picked up the virus from, or are they linked to any clusters, community transmission?
No, it's all just under investigation as of today. It was notified overnight, so there'll be a significant investigation as to where that individual has been, the potential testing of their close contacts to see whether they picked it up from that individual or passed it on.
Have we not been tough enough? I know that you've said repeatedly, I've urged. Could we have been tougher to prevent this and any further spike as a result of those protests?
Look, I'm not the expert in how you manage protests. Clearly, a protest is something that can happen regardless of the legal consequences. People have felt very strongly about this. They've happened in places where it's been against the law or whether it's been legally enabled. So they're difficult to manage in terms of people turning up, but I'm not in law enforcement. I make my public health statements, and I've been very clear about them.
Could this prompt another testing blitz or some other measures to lock down any sort of infections that came from the project?
Look, we hope the testing blitz isn't over. We're saying anyone who's got compatible symptoms, runny nose, sore throat, fever, headache, to go to a testing site. There are still a number that are available. They're very convenient. People have waited a few days for some results, but by and large, the turnaround time is now between 1 and 2 days. So you can get a result quickly. You can get back to work. You can get back to seeing others with a negative test, and if you've recovered. So I do urge people to get tested.
Just one more on the Ridges. Since the outbreak has started, has anything specific changed in the hotel in terms of how they're doing things, the processes?
There has been a complete review of all processes and procedures at the hotel, so how people's understanding of the use of personal protective equipment, how they dispose of contaminated personal protective equipment from cases within the hotel, all of the cleaning arrangements, all of the reinforcement about the appropriate distancing, the appropriate exclusion if developing symptoms. So all of that's been reviewed, but there will be, a further digging into exactly what might have happened to see if there are further recommendations to make.
Are there quarantine travellers still there, and if so, how many?
I don't know the case numbers in that hotel. My understanding was they all decanted to a different hotel, so I don't know that there's anyone there currently.
Just on Black Lives Matter protester, I assume that privacy laws would preclude you sort of releasing a photo so people could work out whether they were standing next to this person.
Yeah, we would go through a process of interviewing, as we do for any confirmed case, who they know that they've been around for more than 15 minutes. If they can name them, if they've been with a group of people who are acquaintances or friends and they can name them, we'll follow up with all of those individuals directly. But it is a case in point about the app. If there are people that you don't know that you might have been within 1.5 metres for 15 minutes or more, that's when the Bluetooth handshake triggers on the COVID app. And so even if you don't know that individual, even if you can't name them and their contact details aren't known to you, that Bluetooth handshake pings and the health department can be informed. So if both individuals, those who are later confirmed as positive cases and anyone who's been a close contact for more than 15 minutes, if they both have the app, then that's the process that notifies the health department to be able to follow up those individuals.
But it was like we were on a downward trajectory. It's 8, it's not like it's 80, but
too?
Oh, I'm always disappointed to see new numbers. I will continue to bang the drum about identifying these cases, isolating them and following their close contacts. I think if people are tested, we'll know where the cases are in Victoria, and we've got an opportunity to end transmission by virtue of identifying those cases. Clearly, as restrictions are eased somewhat, our control mechanism is identifying cases and isolating their close contacts, and so that's why the test and trace mechanism is a really critical one now more than ever.
So you're still comfortable that driving tests that they're going to go for a Monday? You're still comfortable given what you've seen overnight now?
Yeah, look, that's been under consideration for some weeks, and the recommendation was made to Department of Transport on the basis of how things have gone over a longer period of time. We'll have days with a number of cases and days with no cases, but the mitigations that are in place to manage risk in those settings have all been recommended and will be implemented.
Schools and places of work with small groups of people are gathering, should they be asking people if they or their close contacts have attended the protest, and if so, to refrain from interactions with other people? Should people be?
Look, it's really a matter for any of those settings. As I say, we're not recommending quarantine for people who've attended, but we do say anyone developing the beginnings of any symptoms needs to be at home and getting tested before they go back into those kind of group settings.
We've had 8 cases again today. We had 4 yesterday. Some obviously are linked to an outbreak or things like that, but it seems like we kind of have these cases rumbling on even more so than, say, New South Wales are now. Why do you think it is that that's happening in Victoria? Is it because people aren't following social distancing? Is it because we're a particularly busy city or state? Why is it that we seem to be rumbling on and others aren't?
Yeah, look, clearly we have had stronger constraints than a lot of other jurisdictions. For this very reason, we knew that New South Wales and Victoria were hit harder from the beginning in terms of where we were in the hub of international tourism when this all kicked off in late January, February. So there was more seeding into Victoria and New South Wales than any other jurisdiction. So it's clear that outside of New South Wales and Victoria, it's been relatively easier to manage by virtue of that. New South Wales has done very well. Why there's ongoing transmission in Victoria is difficult to say, but we're working in exactly the same way as New South Wales, testing as much as they are, and really with the same kind of messages around physical distancing and testing and tracing. So it's a concern to me that we've still got it. I would love to see us get to zero transmission, but it's entirely within our grasp. And I think all Victorians need to bear in mind that what they do for themselves individually in getting tested is something for the whole state to get us to a point where we can live differently, which is what we're all looking to do.
Is Victoria testing more than other states?
Victoria's certainly tested more than other states. We're up. I think you turn over a rock, you find something. We're doing more testing. We're going to find some cases that would otherwise maybe go undetected. So I'm very happy with the rates of testing, but they've fallen off in the last few days. I would again encourage Victorians to get tested if they've got symptoms.
Just to clarify, if the protesters didn't have the app and they might have been around some strangers for a period of more than 15 minutes, the department won't be able to track them down because they can't breach privacy by identifying the individual and the like.
Well, that's right. That's the same across Australia, and it's the same whether you're attending a protest or you're going to a retail setting or you're buying food. If there are people around you, but you can't identify them, then they are impossible to identify. We know that if it's a casual contact, someone who's just walked past you for a few minutes, that they're really not at risk. The first 1,000 casual sites that we had in Victoria, or casual contacts, we didn't find anyone who picked up the virus when we named places where people had been but hadn't had more than 15 minutes contact. So that very brief contact isn't really a risk, but we do know that more than 15 minutes it does substantially increase. All right. Thanks, everyone.